Welcome! In this lesson we are going to discuss retrusion treatment. In this model, the main complaint is the position of the frontal teeth. We can see it from both sides, the incisors namely, and at the same time the posterior teeth are in some good contact, and you can see it from the left side and on the right side. At the same time, the position of the frontal teeth is not correct. They are retruded or inclined towards the palate. At the same time, we can see the crowding both on the upper arch and on the lower arch. In this case of retrusion, we know that we may resolve the crowding by giving the teeth good inclination. When we incline the teeth, they follow a wider arch and we obtain space we need. Also, on the upper arch, we can see the tremor in here, the spacing that can be beneficial for us. At the same time, when we speak about lowers here, we might consider some IPR, and especially when we see the rotations or teeth disposition like here. Now let's have a look at the setup as we got it from the Exceed lab. If we try to see the IPR as we have for the uppers and the lowers, we can see that there is actually no IPR for the uppers, as we have discussed before, and on the lowers we have in the frontal region, because we don't have enough space for that. Let us look at the lower arch. When we see the movements, we see that they are combined proclination as well as the bodily movement, because we understand the bone limits for these movements, and in the end the teeth are in their right positions. If we look at the upper arch, the movements follow the same pattern, and so they follow the our normal arch form. And if we look from the side, we can see the inclination change, which should also be analyzed and considered according to the patient's profile. We don't have a big proclination here according to the clinical situation. Now, if we look at the attachments, we see that these are the attachments here, the blue ones. You will remember that the triangle attachments are used to fix the aligner and also for anchorage, and the other attachments, the vertical ones, are used to control the teeth movements. Here we can also see on the lowers the power ridges to control the torque and the movement. And another thing is that on the upper arch we can see the pink attachments, which are actually bite ramps that are made on the aligner, not on the teeth, to disocclude the arches to provide better tooth movement. Another thing we can see is the gingival level difference. This problem was the patient from the start of the treatment, and it is not solved orthodontically directly. So this recession can be treated surgically after the treatment. As you can see, the treatment plan is quite simple and the results are well achieved.